Welcome back to Shrinking It Down, Mental Health Made Simple. I'm Dr. Gene Beresin.
And I'm Dr. Steve Schlozman.
And we have our guest, Dr. Ellen Braaten, who's an Associate Director of the Clay Center for Young Healthy Minds. So we're starting off with a series. And many of us as parents wonder about, like, does my child need to see a professional? Should my child go to a therapist? And we thought that it would be really valuable for us to kind of have some discussions about, like, how do we decide, how do we know what's normal and what's not normal, and then kind of navigate that world with you guys. So, Steve, what should parents be looking for?
You know what, it's such a broad question, right? So it comes to us all the time. How do I know if my kid needs some help? What should I look for in my kid that sort of separates them from being like a normal, irritable kid? One of the dilemmas is that we define things like depression in kids as being irritable, wanting a lot of carbohydrates, wanting to sleep all the time, which sounds a lot like being a teenager. So it's really hard to sort of tease these things apart. So I think we might be better off in answering this question if we create a kind of hypothetical story. And we can use this story to run through everything that we talk about. So,
and this is not a real story. This is a compilation of
we would
all kinds of kids that we've seen over the years, and we're just kind of taking bits and pieces from everything else.
Yeah. So never in a million years would we obviously talk about our patients here. But there's a certain similarity that a lot of folks have in common. That's how they end up coming through the door. So what do we want to call him? What should we call this kid?
Well,
I called him Melvin. You didn't like Melvin. Are you okay with Melvin?
Melvin's okay. Mel.
Okay. Mel. He's like a 96-year-old guy. Right.
He's the oldest. He's the oldest man
child
in the world.
Psychiatry patient in the history of the world.
He's actually not. So Mel is a 13-year-old scrawny kid with acne, who's kind of a nerdy guy.
Voice squeaks probably.
Yeah, a little self-conscious.
Hasn't quite made his way into puberty.
Doesn't quite know where he's fitting in, but he's kind of got friends and he's at school.
Have you looked at my middle school yearbooks? I feel like you're talking about someone
Right. And so Mel, I'll ask you, Ellen. So let's say Mel, parents notice that he's not talking as much, he's spending more time in his room, he's maybe playing more video games,
just clarify, how much more video games?
Well, let's say instead of a couple hours a day, let's say he's playing 6 or 8 hours.
6 or 8
hours. A long time. He's just, skipping dinner and staying up there and saying, no, I'm playing.
That's a long time.
It's a long time.
Yeah. Okay.
But so it's out of the ordinary, but let's say they've noticed a change. So what do you think?
Well, I think it kind of brings into play the sorts of things that parents do worry about. Are things going okay at school? Are things going okay emotionally? Is he developmentally appropriate? Is he developing like his peers are? Or is he anxious, depressed? So I think any of those things could be possible. He could, as you were saying, also just be a normal teenager as well, who's just going through a couple of weeks of something that happened maybe in school. It's just making things a little more tough for him. He'd rather just immerse himself in video games. But I think it sort of brings into play all those sorts of areas that we kind of worry about as a parent.
So just to summarize it, so you mentioned that parents are looking at a number of things: academics, peers, activities, behavior at home in the family. And
she mentioned developmentally appropriate, which is a term I've used actually with med students, and they get kind of put off by it because they feel like I'm calling some people inappropriate. We don't mean that when we say it. No. So what do we mean?
We mean that is he developing at a rate and at a pace similar to his peers? So, for a year-old child, we would say, are they walking? Are they starting to speak a few words? In the teen years, it's a little bit different. It's are they doing the sorts of things that a normal teen might do, teen might do?
But look, let's face it. Most folks haven't studied development. Most parents are wondering, is this normal or is this not normal?
They might intuitively know developmental
things. Yes, I think that's what it is. I think, like in talking about his parents, it's that feeling that parents have that something's just not right, that kind of feeling in their gut that they sort of worry about. Something's not quite right. And they may not be able to pinpoint that, at teens at this age do this, or even, my 2-year-old should be doing that, but it's that feeling like there's something that just doesn't feel right. And I think that's the first kind of seed that you're talking about.
So one is their own intuition that something is out of whack.
Yes.
And the second one might be that you mentioned is comparing him to other kids that they may know, whether they, if they go to church or synagogue or see kids in the playground or see his friends, they see him as, or they think of their own childhoods. He's acting differently than I would think a 13-year-old guy would be behaving. So a comparative.
Yeah.
And just to be clear, this is really scary for parents, like when this
Yes.
happens.
Yeah.
In part because of the uncertainty. Like it's all, you don't know. Like you don't want to overreact,
Yeah.
but at the
Right.
same time you don't want to miss something. And as we've gotten more comfortable as a culture accepting the possibility that kids can run into psychological problems, the onus becomes more on the parents to be able to see it in time to
Yes,
do something
yes.
about it. So they don't. I guess that's why we're doing these.
No, I think it's one of the,
vlogs.
the toughest thing that a parent has to deal with is my child okay emotionally or behaviorally? I mean, it's one thing, we all get worried about our children when they're struggling with an ear infection or the flu, but that emotional component is so hard for parents to have to deal with.
And the thing that I pointed out in the story is that they've noticed a change. So one of the things that may tweak them and tweak most of us is, you kind of expect your kids, they're behaving in a certain way, but then when there's a change in behavior, that's often a big red flag, isn't it?
It is. It can also be normal too.
Right. I just
and
wanted
that's
to
the
point
tough
that out.
thing.
That's-
Yeah.
How many parents come in and, well, I'll take it back. So parents come in and say, the kid's changed, and I'll say, well, it may just be a phase.
Right.
They may be going through something.
Like we do expect a 2-year-old to be more independent, and with that comes tantrums, and so and the same thing with a teen. We expect them to be more independent, less connected from us, and that's where I think that's why they come to us, is to figure out is that change normal
Right,
or
because
is it not?
they might actually do things to pull away from us that to the parents look kind of excessive or different, but it might just be their desire to take a step out on their own.
So look,
right.
so just to clarify things for our listeners,
For
or
Melvin.
our
And for
people that are
Melvin's
watching,
parents.
for Mel's parents out there, you have a sense that something is changing. So, one, what do you look for? And two, what do you do about it? Where do you go? Who do you call? I mean, many parents, and this is scary. So,
I think the important thing is you call and you reach out to someone, because that's how you find out if this is appropriate or not.
So who do you
So
call?
it can be the child's teacher, the pediatrician, another parent of a child in his class.
what you say is really important is that parents should check in probably with other people in Mel's life who know him. So has the teacher noticed anything different? Has the coach noticed anything different? Have, maybe friends, parents noticed anything different?
You know what? And
pediatrician.
But just 1 second. None of that is definitive, right?
Right.
Because we actually know that the last thing to suffer for kids is the way they look in the world outside of your house. There's so much pressure for them to remain connected culturally.
And to behave appropriately to the context.
Right. So you're going to see them laughing with their friends after school, which is probably a good sign, but it doesn't necessarily mean that they're doing well. Doesn't mean they're not doing well either. If they're not laughing with their friends and they used to be,
Yes.
then I get worried.
So the biggest
Yes.
red flag. So let's do some take-home messages here. Check in with other people, and if they're doing okay in all these other areas, maybe you have less to worry about. If they're not doing okay out there, then you really should be worried. But like you said, Steve, sometimes they'll put on an act out there, and they're really suffering and struggling, and so you don't have that red flag. So let's say they're laughing at school. That the teachers and their parents friends say, "Oh no, Mel's Mel, he's great," but you notice that there's something different at home.
Then what? What do you do?
Well, one thing we haven't mentioned is just talking to Mel as a parent, kind of talking to him.
we could do that. We could actually talk to the
You could actually talk to
and
a
see what's,
13-year-old.
sort of checking in with him and seeing what's going on with him. Now, that doesn't mean he's necessarily going to give us
But
these
how do you address the issue? Because so what do we notice? So Mel is shut down a little bit. He's more isolative. He's not socializing as much. His behavior's changed. Okay.
Well, I think one of the things you want to, in terms of talking to him, he might not be forthcoming. A lot of 13-year-olds are not. So you want to sort of talk around it, I think, talk about what's going on at school for even other kids, what's sort of happening for other people, what's happened in his peer group or in school. Or so I think that's one way to sort of approach it, is not necessarily directly. I'd
Yeah,
like
I've
to
often
think we
found
could do that, but
sort of
I think
displacement.
Well, the
Yes,
last thing
yes.
the last thing a 13-year-old wants is to say, "Oh, we got to sit down and have a talk."
right. Yes. Oh, yes. I'm feeling depressed. And they don't typically do
Well,
that.
usually when you say we want to have a talk, you're
I
going to
know.
talk about where babies come and then they're out the door.
Right.
So you're
The
not
same
gonna
with this,
do
like
that.
how are you
Right.
feeling is oftentimes not a good opening line
Yeah.
for a 13-year-old. So
So do you say, is everything all right? Or do you say, how are things at school? Or do you say,
well, I
How
think
are
you can
things?
actually just, how are things, or even just
Yeah.
reflect back. I sort of noticed that you've been and
Different.
sort of feeling
Some things have
different.
changed.
Yeah, and I'm feeling just kind of concerned. Like, you sort of voice your own concerns and not overblowing it, because that also causes them to shut down, I think.
So one other thing about this, before we even deal with in the present, is that oftentimes a good tip for parents, since one of the things we really want to do in these shows is give you guys tips about how to kind of handle these situations, is when you start talking with your kids at a very young age, so that the culture and the norms at home is to kind of just chat and not necessarily sit down and have like therapy sessions or family meetings, but just talking about things, talking about sports, talking about friends, talking about, stuff in the family. But having kids talk with you, if it becomes part of the norm, then you're not just kind of out of the blue saying like, well, Mel,
Yes.
we've seen something really different here.
Mel,
Which
we
is-
haven't spoken in 3 months, but now I'd like to
Yes,
talk to you
yes.
about
Right.
your mo-"
So step one is take it back and start young with these kids, and maybe Mel will be able to say, yeah, Mom, things have been tough, and then you can have a conversation.
Yeah.
Well, I got to say, more often he won't say,
No.
yeah, things have been
More
tough.
of, yeah.
At least
More
that's
often
been
he'll
my
say how
experience
things
with
fine.
the patients
Fine.
I've seen. It's,
So are these the
Well, he
mo-
might say, yeah, things are fine, but there's going to be a music to the way he says it. And that's what, and that's probably what the parents are responding to in
Yeah.
the first
They're
place.
picking up
Yeah.
on the emotion, on their what we call the limbic system, on the music.
Yeah.
Yeah.
The music.
Yeah.
The words and the music aren't going together.
Yeah.
There's a disconnect.
So what's so bad about all this stuff?
Well, actually, it is kind of on the milder side of things, but let me up the ante. So let's say that over the course of a few weeks, Mel gets more irritable. Mel, who's typically kind of an easygoing, kind of a chill guy, has some explosions. Let's say that, you overhear him having a fight with his friends, and he never ever fights with his friends. So he's getting angry, irritable, kind of like really nasty. And then what would you do?
Well, one of the things I look at is what else was going on in his life at that time. What's happening in the family? What's happening at school? Sometimes it can just be a breakup with a girlfriend, a first girlfriend or boyfriend or whatever, and so you want to just check out what's going on in the environment to make sure there's nothing that's causing this. But what concerns me about what you're saying is that it's not getting any better and it's getting worse, and that's a really bad warning sign. The longer this goes on, the more worried we get. The more it seems to deteriorate in terms of his symptoms, the more worried we get.
Yeah, I didn't mean to interrupt you. I'm sorry. So what you're saying is that the less permission we have to say, oh, this is a phase.
Right,
Right.
exactly.
Like
right.
It's a fate instead of, right.
So in terms of trying to figure out, does my child need help, looking at the length of time and the intensity of it, I think that's the two things that you really want to consider in terms of, does my child need help?
Right. Right.
And also what's going on in his life that you might be able to tweak or change or address that might.
And think about it, I guess, in the shoes of a 13-year-old. Breaking up with a girlfriend, I've done it many times before I got married.
But you break up with them, or they broke up with you?
They always broke up with me.
That's what I
but
thought.
it's immensely painful, right?
It is.
And when you're 13,
It's the
it
end of the
is the
world.
end of the world. So if
Yes.
the parent says, oh, it's nothing, there's two mistakes there. One is it actually might be something huge in the kid's mind, and even if it's something huge but they'll get through it, you don't want to act like it's nothing and make them feel
Right.
bad.
Right.
So it could be the harbinger of something bad
So
coming.
another tip
Yes,
is
good.
take seriously what your kids are experiencing, even if you think that it's, in the big scheme of things, it's trivial. For a 13-year-old, it is life or death. It is the worst thing that could have ever happened to me ever.
Yeah,
That is one of the biggest triggers.
totally forgiven Sarah McLaughlin for breaking up with me when I was 13. I don't think about it ever now, just for the record.
I'm glad you got over it.
Yeah,
That's-
I'm
yeah.
still over it.
Okay, so let's say we decide as parents that we're ready to, get some help. And so how do you approach, the next step is, you want to find somebody, but you certainly want to prepare the kid, right?
Even before you address it with the kid, I think you have to address it with yourself. So it's very rare for me to see a child who doesn't want to see me if their parent is enthusiastic about it. But if their parent is ambivalent, that tends to be the kind of child who's also ambivalent himself. So I think you have to sort of check in with yourself, is this what I want? And then you have to find a competent person so that you feel confident that this person is going to draw your child in. Like, if you can get them through the door, you want to make sure that that person is going to take it from there and that build an alliance. So I think two things: you've got to be confident that you're making the right decision, and then find somebody good. And that's not always that easy to do.
Both, neither are easy.
It's
really.
never easy.
It's not easy to be confident, and it's not easy to find a good person.
Right.
So let's split them apart. What would you advise parents about becoming confident in their decision?
I think knowing that no one's development is easy, and that reaching out to somebody is not a dishonorable thing or something to be ashamed of. But most parents feel that a little bit. They feel like if I was a good parent, I wouldn't need to be seeking help for this. So I think kind of dealing with your own emotions around that.
You mean parents blaming themselves?
Yes.
Okay,
Yes.
so that's one issue. What about the stigma of having your kid going to see a shrink?
I think a lot of parents do still, even though they're very open about many things or talking about it in the, about someone abstract,
Right.
they're still,
Not
my kid. And almost all of us feel that way, that
Yep.
there's something like,
Yeah.
boy, if I were doing a great job as a parent, my child wouldn't need to see a shrink or get an evaluation. And I think just really knowing that it's okay, and actually it's not
What I've said to
shameful.
parents is, if if Mel had a headache for 3 weeks and it just wasn't getting better, you would take him in to see someone. And you wouldn't worry that maybe this was overreacting or that
Right,
they're so
right.
that sort of skirts the stigma issue, but puts it in this model that they can
Right.
understand. So, and then I say, this is kind of the psychological equivalent of that headache that's worrying you,
Yeah.
and there's not a lot of reason for you to worry.
Right.
In other words, you shouldn't have to worry without getting it checked out. There might be something to worry about, but you should have
Yes.
someone you can go talk to.
Right. And we all think we're the only ones. Every parent thinks that he or she is the only person going to and seeking help for their child, not realizing that many children in their child's class has also
Well,
gone to do that too.
we know the data. The data is that 1 in 4 people will have a psychiatric problem, and 50% of these problems begin in childhood, which means everybody who's listening, watching this, knows somebody either in their family or friends, or that has had a problem in their family,
Right.
and oftentimes with a kid or an adolescent, right?
And one way to rationalize, I don't even know if that's quite the right word, but to know that the earlier we intervene, the better the outcome is going to
That's
be
what
for their
this-
child. So that's if we're as a parent struggling with that, that's a good way to kind of look at that.
So can I ask you, what do you say, Ellen? I mean, I know what I would say, but what do you say if, I've often
may
heard
say this
parents
better, so yes.
say, well, I've often heard them say, like, how do I know I'm not going to do more damage by kind of forcing them to do this? Like I just worry, Steve, that making my kid go see somebody is going to be such a rift between us that I won't be able to repair that, and I'll make it even worse.
If you're seeing somebody competent, I feel confident that I trust the process of therapy. Actually, I'm curious to see what you would say to this.
Well,
how
a rift
you'd
between
answer
us.
that.
So what you're
Yeah.
I think there are a couple issues here. You're talking about if I send him to a shrink, there's going to be some kind of a breach in our relationship.
If they don't want to go.
If they don't want to go.
They don't want to go.
Yeah. So that's been the concern. So parents have said, I really don't want to make them go because they really don't want to go, and I feel like I've just barely got them listening to me anyhow. So now to kind of twist their arm and make them go feels not right.
It'll
to
hurt
me.
the relationship.
Yeah.
And
Yeah.
another concern that I have heard over and over is, what's it going to do to his own self-esteem? How is he going to feel about himself if I'm saying to him, you got a problem, you're sick,
Yeah.
you need some help. And then I'm kind of like saying that he's got, it's his problem. When in fact, the mind, the body, brain, and the environment are also interconnected. It's not anybody's, it's not any one person's fault. It's not any one, But we know that from data, but it does make people feel, it's hard for anybody to go to see a shrink because you feel bad about yourself.
There's still stigma.
Yeah.
Yeah.
So what do we
So
say?
what do you say? I want to know yeah, I'm curious to hear.
What I've said is, well, first of all, I sort of quote the evidence, and I'll say
Right,
there
exactly.
is really
Yes.
no
There's no
evidence
data
to
that
show
shows
that
that.
this is going to be a harmful. If you find someone who doesn't have to be the best person on earth, just has to be a competent person, you're not going to do harm.
Right.
And your child would much more like to think of you as somebody who was willing to investigate and make
Yes.
sure that they're okay
Yes.
than somebody who let a problem slide if it weren't
Right.
there. You don't that's not a
And-
risk you want to take.
And I think kids really like to know their parents are in charge, that they are going into someone's office knowing that we're going to figure out what this is and we're going to fix this. Right. At the same time of sort of keeping it kind of matter of fact. And I think that's where when parents get emotional about this decision, which is an emotional decision, but when they sort of show that to their kids, I think that's where the kids can start to pick up on that anxiety, but just sort of say, you know what, we've got an issue here, we're going to figure out how to do it, I'm the parent and I'm going to help you do that. I think that can just be very soothing to a child or an adolescent.
So if the parents are together and they're confident and they're not ambivalent and they've worked this out and they've presented this to the kid, so then the big question is, how do you find somebody? I mean, how do you find somebody that's competent? How do you find somebody who you can trust and who will not mess your kid up? Because the other myth is that shrinks are crazy, shrinks have crazy kids, and shrinks are going to mess people up, and they're not going to be helpful.
Yeah, all three of those can't be true.
That's right. Yes.
But I'm exaggerating, obviously. But we've got a bad rep out there.
Well, it's extremely hard. Like there aren't enough of us to go around.
Right.
And
You've
so
written a book about this, right? So
I have. I know. And there just aren't enough people to go around.
So there's
it's-
Just to be clear, that's not a figure of speech Jean's using. Ellen's actually
Yes,
she
written
actually has
the
it.
book about this.
about how to get mental health, how to get mental health. for your
Like, it
kids.
could not be more bluntly titled.
Yes, exactly. And so I think really the best way to find someone, though, if you can find someone, and a lot of it depends on where you live in the country, but even in the places where we have the best ratios between professionals and children who need help, it's still really tough. But I think talking to somebody else, getting a reference from somebody you really trust,
Yep.
looking at their credentials, making sure you're going to someone who's licensed, whether it's a social worker or a psychologist, a psychiatrist. I think that's key
Yeah.
to know that they have a certain amount of credentials that allow them to practice.
Well, and people you trust. So who are they? So your pediatrician,
Pediatrician.
friends,
are really important.
teachers, counselors at school. I mean, people who've had experience.
Yes.
And then get a bunch of names.
I
Then
think one of the things is you have to then decide if that person is right for you.
Okay.
So just because that person is great and well respected, and they very likely are, that doesn't mean that it's perfect for you. And I think going into this, telling a 13-year-old that we're going to try this, we're going to kind of see how you like this person, how I like this person, that sort of gives them a little bit of power in this decision-making process.
Yeah.
They don't get to make the decision,
No.
but they get to decide whether or not this is the kind of person
Well,
they
so
can
one
work
of the
with.
things that I've learned over the years is that, and I often say to 13-year-olds when they come in is, I talk to them, I try to get to know their story, I try to figure out what's going on. But then I usually say something like, your parents are sending you to see somebody. I may not be the right person for you. I might remind you of an uncle that you hate. If that's the case, you shouldn't see me. Number one. And number two, the door's open.
Mm-hmm.
You can walk out. You can leave. Now, your parents may send you to somebody else, but if you don't feel comfortable here, if you don't feel, and you don't have to decide today, but if you don't feel that this is the right match, because that's what you're talking
Yes,
about,
yeah.
that's where the kid does have a big say in the
Yes,
matter,
yes.
as well as the parents.
And
Yes.
you know what? I don't even put them on the spot. What I say is, I don't even want you to answer this now. I want you to go home and think about it and talk about it with your parents. You're not going to hurt my feelings. I'd love to be able to help you if I can, but if it's not the right fix, that's fine. So why don't you go home and think about it and let me know.
And so pointing out, trying to find a competent person, I would look for that in a competent person, that ability to sort of be flexible, to not adhere to one sort of way of treating a child, to be able to know their own level of competency, really, to be able to talk about that with the child and the parent, about here's what I can offer, here's where I think I can be helpful. And they should be able to answer that for you.
Right. I think, Steve, what you both said is really important, because what we're saying is that, it's the parent's decision to bring a kid in for evaluation. The kid doesn't have a choice. But the kid has to feel in that office, that Mel has to feel that he's respected, that he's got some choice, that we're treating him as an autonomous individual who can kind of like figure out whether this is the right place for him or not, and let him sit on it and think about it, and give him that kind of freedom and that respect. And without that, it's not going to fly.
I mean, even the data suggests that regardless of the treatment orientation, I'm sure at some point you'll be talking about the different kinds of
therapies.
It's really the relationship, the quality of the relationship with the person administering the treatment that is most important. So that is really important to make sure that relationship is.
I'm so glad you brought this. So
key.
something as we wrap up here, I get these calls from parents that say, I need a CBT doc, or I need a dialectical behavioral therapy. And they've read the studies, and the studies show that, say, cognitive behavioral therapy is the most. And these are all absolutely true facts. And I'll say, we're going to work to find that for you. But what matters more than that even, and I can rest comfortably in the data, is the relationship that your child has with that doc, no matter what kind of therapy they practice.
It's not just a relationship with a shrink. It's with any professional. All doctors, psychologists, nurses, attorneys, professionals in general, what matters is that you feel that not just the person has great credentials, we want that. We want great knowledge, skills, whatever. But you've got to feel that you can be yourself, trust this person, and that there's a relationship that really matters. And all the data shows that that's probably the most important thing in a professional relationship.
Exactly.
So what are we going to talk about next time?
I think what we should talk about next time is, what do you do in the first meeting? So like, once you've gotten there, what happens? I mean, many folks who are watching haven't taken their kid to a shrink or haven't gone to a shrink, and what happens? What are the expectations? What's supposed to happen? What can you ask for, in the first meeting? So, thanks for watching. I'm Gene Beresin.
I'm Steve Schlozman.
And thanks, Ellen.
You're welcome.
She gets to say what she is.
I'm Ellen Braaten.
Of course.